Dr. Hitesh Garg. I am heading the Department of Orthopedic Spine Surgery at Artemis Hospital, Gurgaon in Delhi NCR region in India. I have been performing scoliosis surgeries in this hospital since 2011, and till now we have completed around 1100 scoliosis surgeries with more than 99% success rate. I did my higher training just for learning scoliosis surgery at Shriners Hospitals for Children, Philadelphia in USA. So what exactly is scoliosis? Scoliosis is actually a three-dimensional deformity of spine. Normally, when we look at the spine from the back, it is a straight structure. In scoliosis, the whole spinal column gets twisted in three-dimensional planes and gets tilted like this, because of which one portion of the thorax comes out and is visible as a big hump on the back. Now this scoliosis is usually observed by parents when their kids are taking a shower or their kids are growing rapidly. Scoliosis can be picked up very early. Sometimes it's picked up at 1 year of age, and sometimes it takes almost 10 to 15 years before it is picked up. And in very few cases, scoliosis appears even in adult age at 30 or 40 years of age. The treatment of scoliosis is categorized based on angle of scoliosis, known as Cobb's angle, which is the maximum angle of deviation in scoliosis. So we take an X-ray of the whole spine in standing position and measure this angle. If the angle of scoliosis is less than 25 degrees, we just observe the patient by taking serial X-rays every 6 months and tell the patient that they should do exercises to correct it. If the angle of scoliosis is between 25 to 40 degrees and the patient is still in growing age, we give them a brace. But once the angle crosses 50 degrees or angle has been increasing and goes to more than 40 to 45 degrees, then we like to operate on the scoliosis. Now, why do we need to operate on scoliosis? Because the natural history of the disease tells us that once the angle of scoliosis crosses 50 degrees, the progression of scoliosis does not stop even after the growth of the child stops. It keeps on getting worse by 1 to 2 degrees every year, and once the scoliosis crosses 80 degrees, then the patient starts having respiratory issues. Because as you can understand, it's a three-dimensional deformity, so the whole thorax gets twisted, it starts compressing the lungs, because of which the patient is not able to breathe properly. So initially the symptoms start like the patient, when they start running, they will feel that they are not able to take the breath. And once the scoliosis angle crosses 90 to 100 degrees, it starts compressing our abdominal alimentary canal, our food pipes, because of which the patient starts having difficulty even in eating, and then their growth, they become thinner and stuff like that. Once the angle of scoliosis crosses 120 degrees, patients start feeling severe pain in the back, and sometimes it can start compressing the spinal cord and the nerves and can lead to weakness in the legs, which is known as paralysis, and even loss of control over urine and stools. But we don't like to wait to operate on scoliosis till the angle gets to 80 to 90 degrees, because the complexity of the surgery as well as the risk factors associated with the surgery increase significantly as the angle of scoliosis increases. So whenever the angle goes more than 50 degrees, we always tell the patient to get the surgery done as soon as possible. And in this also, there are various kinds of surgeries that we perform for scoliosis. Now, if someone is having a scoliosis due to malformed bones, like a hemivertebra, where the vertebra is formed half, and the patient comes to us maybe at 4 to 5 years of age, so we remove this hemivertebra, do a very small fixation, and we correct the scoliosis right at that age. But if the scoliosis is involving the whole of the spine and the patient comes to us at an early age, like 6 to 7 years of age, and the patient is still growing, then we don't like to do the final fusion surgery at that time. So what we do in that is we do growing rods. So we put rods to control the scoliosis, and we keep lengthening these rods every 6 months as the child grows, so that this surgery does not affect the growth of the child. And once the child is 12 to 13 years of age, or he or she is skeletally mature, we do the final fusion surgery. Similarly, if we detect the scoliosis once the patient is skeletally mature, like 13 to 14 years of age, we like to do the final fusion surgery, where we put multiple screws in multiple vertebrae or multiple bones of the spine, and then we apply a straight rod and try to correct this scoliosis with the help of newer instrumentation techniques, where now in the newer instrumentation we use this very strong straight rod and bring the spine to the rod so that the spine corrects to the shape of the rod, which is straight. And at the same time we de-rotate the whole spine. As I told you earlier, that it is a three-dimensional deformity where the whole spine gets rotated. So we de-rotate it back to its original position, because nowadays we are using a very powerful pedicle screw system. Now the biggest risk factor associated with scoliosis surgery is paralysis. That once we correct the spine, the patients can lose power in the legs. Now to prevent that, we have been using neuromonitoring since 2014 in this hospital. In neuromonitoring, during surgery, we monitor the function of the nerves and muscles by putting multiple wires through the spine, so that when we are correcting the scoliosis, no damage happens to the spinal cord or to the nerves. Similarly, now we have very good three-dimensional imaging machines like O-arm, navigation and C-arm, with the help of which we can place our screws perfectly without touching the nerves or the spinal cord. But still, I suggest that once scoliosis is detected, we should take control of scoliosis as early as possible, because if the angle is less than 25 degrees, we can manage it without surgery. If the angle is 25 to 40 degrees, we can manage it with the help of a brace without surgery. And even if the angle is 50 to 60 degrees, this surgery can be done comfortably, giving a very good result to the patient, where we can correct the spine almost to its normal position. I have been doing scoliosis surgery even at an angle of 120, 130 degrees, and we have been getting good results because of advanced instrumentation and advanced neuromonitoring and imaging technologies. So my advice is that if the parents see that the child is having a hump on the back, immediately that the parent should bring the child to an orthopedic surgeon or to a spine specialist, get an X-ray done, and if there is scoliosis, we should try to tackle this scoliosis at an early stage.